This is Dr. Joshna. I'm consultant ENT and head and neck cancer surgeon at Sagar Hospitals, Jayanagar. Today is World Cancer Day on February 4th. So as we all know, cancer is one of the leading causes of death worldwide, and India contributes up to 1/3 of all the cancers in the world. In India, men suffer from lung cancer and oral cavity cancers the most, and fourth common in the women as well. Not everyone in India can afford the treatment or the facilities for the cancer, and hence we have the responsibility to bridge this gap. Nowadays, there is a lot of new research in terms of detection and management of the cancers as well. However, we are still seeing rise in the deaths due to cancer. How do we bridge this gap? So it is by early detection and management. This gap is created by poor awareness among citizens and late detection and increase in habit levels as well. So I urge every one of you to have a self-screening or screening at our hospital once in a year at least if you have the above mentioned risk factors or you are above 40 years of age, because 30 to 50% of these cancers can be prevented if it is detected early. Thank you.
Hello, I am Dr. Sangeeta Rao, Consultant Obstetrician Gynecologist, Sagar Hospitals, Jayanagar. Cancer, the word itself is scary, but definitely early detection saves life. You beat cancer by how you live, in the manner in which you live. Now today, I'll be just telling you about the most common cancers in women and how to do the screening early. Early detection definitely saves life. Most common cancers in women include breast cancer, 30% of all the cancers, which has a very bad death rate. The other cancers include cervical cancer, uterine cancer, and the ovarian cancer. Now coming to the screening tests. When it comes to breast cancer, the early screening tests would include simple breast checkup. So please get your routine breast checkup by your doctor. The other tests include a sonomammogram, that is an ultrasound of the breasts, and the mammogram above 40 years age group. Now coming to the cervical cancer. When it comes to cervical cancer, the most important screening test which most women don't come forward to is the pap smear. So people have this tendency to walk away from pap smears because of the pain. Trust me, pap smears are not painful. Go ahead and get your pap smears done, which really helps the doctor a lot to detect any early cervical cancers. Next, coming to the uterine cancers. Now, uterine cancers, that is the endometrial cancers, are most common in the older woman age group. Now that comes during the menopausal age group, that is somewhere between 45 to 55 age group. The most common symptoms include postmenopausal bleeding. Now 1 year of complete no period is menopause. Any bleeding, any spotting after this 1 year of no period, after this menopause, is abnormal. Rush to your doctor for a visit. A simple endometrial biopsy can detect early endometrial cancers. HPV virus, that is the human papilloma virus, carries a greater risk in causing cervical cancer. Cervical cancer is the most common gynecology cancer in women, most commonly spread through sexual contact. Now, as a boon, we have got the HPV cancer vaccines available. Women aged between 11 to 45 years, please go out and ask your doctor to get a shot of human papilloma virus cervical cancer vaccines. WHO has shown to all of us that it gives 70 to 80% protection against cervical cancer and also 80% protection for vaginal and vulvar cancers. Cancer is not something to be scary. We as gynecologists, along with you women out there, let's fight it out together. That is our goal. Thank you.
I am Dr. Munireddy. I am a practicing cancer surgeon at Sagar Hospital, Bangalore. On the eve of the Cancer Day, I am supposed to give you a few words of awareness to the general public. Whenever I meet a lay person, one of the common questions asked is, what is this cancer? Cancer is actually growth of cells in the body, which is a normal phenomenon. For example, in the uterus, the baby develops and grows. That is by the multiplication of the cells. But there is a normal phenomena there. When the child's growth is complete, the further cells multiplication stops there. Whereas in this cancer, the cells continue to grow without any control, and it invades the other parts of the body, so destroying other organs and finally death. For example, suppose we get a wound, we get a cut there. When the healing is complete, cancer cells will not grow further. The multiplication of the cells stops there by a natural mechanism. But in the cancer, those cells growth will not stop, goes on becoming bigger and bigger, and it spreads. This is cancer. That is the mechanism, the nature, why it happens, we really don't know. Next question which is asked is, why anybody develops cancer at all? That is a question. Very natural. Actually, there are some cancer which run in the families. Those cancers are transmitted from mother to the children through genes. It means cancers are carried through genes. That is one example. But some other cancers, even though they don't get transmitted through the parental route, they can develop de novo. It means newly. For the first time a patient can develop cancer. It is supposed to be due to mutant gene which develops in the body. It means finally the cancers develop because of the order from the genes itself. It means we are already pre-programmed to develop a cancer at birth itself. But in this society, in our lifestyle, there are many things which can influence this growth. For example, smokers, lung cancer, mouth cancers are very common. In uterine cancer, a person with multiple births is prone to develop cervix cancer. Whereas a person who does not have any children at all, patients are prone to develop breast cancer. So these are all the effects of the hormones, but they are not the cause, but they influence the development and progression of the cancer. So in our lifestyle, there are many such causes which can influence the cancers. But being careful and following such norms, we can decrease that incidence in cancer in human beings. The treatment for cancer has progressed a lot in decades. Surgery is really progressive. It can cure majority of the cancers, but we should detect those cancers early in life. And there are other cancers where medicines are available. It's a revolution in the field of medical oncology, where medicines cure these conditions. So, in spite of all these developments, are we successful against the cancers? Not so. Even though to a great extent we are successful, our fight against the cancer continues. Thank you.
Hi, this is Dr. Swaroop. I'm a medical oncologist here at Sagar Hospitals. So on the occasion of World Cancer Day, I have to share a few of my reflections. A few years ago, the word cancer would be associated with dread, fear and anxiety. But now, things have started changing, and for the better. There have been a lot of advances and refinements in the way we deal with cancer. That is because of better understanding of what cancer is and the biology of cancer. And then we have a lot of new medicines which are making life easier for cancer patients. Firstly, we have newer formulations of cancer medicines, chemotherapy, which are a lot more tolerable than compared to a few years ago. Then we have targeted therapies, which basically target the cancer cell and spare the normal tissues. Then we have immunotherapies, which basically train our own immune system to go and fight against cancers. Then we have better supportive care in the form of growth factors and antiemetics, which can make the patient to tolerate cancer without much toxicity. So all of this has led to a lot of improvements in terms of survival of cancer, and a lot of people with advanced stage cancers are also living for a lot longer now. So that was about the treatment of cancer, but what is more important is about prevention. So a few conscious changes to our lifestyle can go a long way in preventing cancer. So we have to avoid tobacco fully. So remember, cigarettes are not cool. We have to stop or reduce alcohol consumption to as much as possible. We have to be active in our lifestyle, take regular exercise. We have to sleep well. We have to be stress-free. And all of this can significantly reduce the risk of us getting cancers. So that being said, remember, if there is ever a fear or if there is a scare for cancer, fear not, we are here. Thank you.